as I have seen you on LinkedIn and just other things and conversations, yeah, I know you're very, very passionate about direct primary care, and you're really involved in that space. And
Hmm.
so, why? I guess why are you passionate about DPC and transforming healthcare through direct primary care?
Well, I think it kind of dates back to just, just the way I was raised with my parents, and they've always prioritized their health and wellness. Going to the gym. I remember being in daycare at the gym, almost daily because my parents were going to the gym. And, when I was growing up, once I was old enough to get a membership, to the gym, I started working out and I played all the sports. And then, my mom always cooked, home cooked meals, which was awesome. And there wasn't a lot of junk food in the house. And so we just always prioritized, health and wellness throughout my life. And then once I, fast forward, you get into the space. I had kind of an epiphany at a TPAC conference a couple years ago because there's a lot of innovation in, healthcare right now that's happening, and all these solutions that are, bringing to the forefront. Independent TPAs, direct contracting, bundled surgeries, DPC, like international sourcing of medications.
Mhm.
Like there's all these solutions out there where, as benefit advisors like myself, we talk about, lowering the unit cost of care. The only
Mhm.
way to pay less for health insurance is to pay less for health care. And so when we were at this TPAC conference, there's I think it was the CEO of Anytime Fitness, and he was talking about this concept of, having health risk scores applied to certain individuals. Like, do you work out every day? Do you, get 8 hours of sleep? And all these different things that, tie into this overall health risk score. And it's just like, yeah, like there's this point where we can only lower the cost so much, where now we need to double down on just getting people healthy. Then we don't
Mhm.
even have to worry about lowering the cost of that surgery or lowering the cost of that medication and so on and so forth. And, here comes DPC. And,
Yeah.
they are challenging, the status quo when it comes to fee for service, um, you know, big system, hospital-based, healthcare, and, it's more accessible, it's more
Mhm.
affordable, it's high touch. They actually get to know you. Patient panel sizes are much, smaller. A lot of the direct primary care doctors that I work with have worked for big systems, and they said enough was enough. I want to do things differently, kind of like what I said early on in my career. Enough is
Mhm.
enough. Enough. I don't want to be a part of this anymore. I want to, create real change in the industry. Just like now, they're like, I want to create real change for my patients, and get them off those medications, or, get them healthier, or lose that 20 pounds that they always wanted to
Mhm.
lose, and just be there for them as a physician. So when they are sick, I can take care of them. And we both know that in the big system where they're, challenged to see, 40 or 50 patients a day, and patient panel sizes are 2,000 to 3,000. And it's like, it's nothing against the doctors, it's everything against the system and
Yeah.
that they're trying to operate in.
Yeah, and I'm happy you said that because I tend to always I guess clarify when I'm uh, speaking on exactly the subject matter you're talking about, and it's and doctors are good people. They went to school and are practicing because they do want to help people. They want to help their patients,
Yeah.
and this system just I mean drives them to what's happening now. I've probably brought this up before too, but I mean, my dad was in that family practice space and also a surgeon. Thank goodness that he always was able, when he was practicing and alive, he was always able to remain as an independent physician, but he still saw the frustrations and the just the complications and the craziness of the system, and even he again it wasn't it was just the insurance or whatever that was forcing him to see that many patients a day where he
Yeah.
was always used to seeing half that many or a third of that many patients a day. And so yeah, it's always crazy when he was talking about all of that. So back on the DPC side, Colton, we understand why it works, and but how is it empowering the employees slash patients? And then how is it also how's direct primary care aligning with like the employer goals that you see out there with the folks you talk to?
Yeah, well, I think, from an employer standpoint, I could probably speak for all of them. They're all trying to, provide better benefits at a lower cost.
Hmm.
It's that simple. We just simply pay too much for, health insurance and, employers, on their P&L, it's, usually in the top five of, the most expensive. And so when, you
You're being
know,
generous there. Top five? It's probably what
top
top
three,
three?
two, three, depending,
Yeah.
yeah, absolutely. So I mean, a lot of the advisors at Health Rosetta, or that's a part of the advisor program, or that speak the same language as me, we're always talking about unbundling a health plan and finding fiduciary and transparent partners, TPAs, pharmacy benefit managers, so on and so forth. And that can that can be pretty daunting for the C-suite. And because it's a lot of different vendors, it's not just one logo on one card. But we've proven that there's a lot of just savings by removing all that waste that's in those big insurance type health plans. And so why DPC works within that model, because we're using, nurse navigation in some cases. We're trying to get
Mhm.
people to lowest cost medications. We're trying to, get someone to the lowest cost surgery, imaging, things like that. But if we have something that's their single source of truth, like direct primary care, everybody knows to say, hey, go to Dr. So and so first,
Right.
because that's just what happens. That's just what people are used to. And we can collaborate with our direct primary care doctors now that, 80 to 90% of what the care they can provide can happen within the primary care setting. But, that other, 10 to 20% or whatever it is, yeah, we're going to need to refer to a specialist or a
Sure.
hospital or, radiology. But if we're collaborating with that direct primary care doctor, they can already, refer that patient. It's much harder if someone gets into the big system and then you try and redirect them from there,
Hmm.
because they're already, maybe got a scheduled visit, or they're already talking to a doctor that they trust, or but they don't know what the cost is going to be, and they don't know what the quality
Right.
is going to be. And
Yeah.
so that's why I also love, the direct primary care in all of my, custom health plans, where we do have a lot of vendors in place. But if I know all those vendors that are in place, direct primary care knows what's in place, and the C-suite of the organization, then it should run very smoothly.